Good afternoon. I am Maggie Miller, and I am the interim director of the Hilton Humanitarian Prize. I hope you are all enjoying the day. I'm certainly pinching myself. I'm just in awe of the brilliant minds and the amazing spirits that have been in this room today. So I hope you all feel the same. I want to take a quick moment to thank our friends at the Annenberg Space for Photography for the beautiful display they shared with us at lunch. I think it brought to life the issues we've been discussing all morning in a way that only photographs can do. I also want to take a moment to thank my brilliant colleagues, Hannah and Saiba, along with all of the other staff at the Hilton Foundation who have made this event what it's been today. Takes a village. You may have noticed that the room has had a little bit of a refresh, and that is because we are now turning our attention to the very important work of celebrating the 2016 recipient of the Conrad and Hilton Humanitarian Prize, the Task Force for Global Health. As Ralph alluded to earlier and Zainab did a few moments ago, Judy Miller, who served as director of the prize and vice president at the foundation for more than 18 years, and who I was not related to, for the record, passed away unexpectedly in February. We have certainly missed her immensely, and particularly leading up to and during this event today. I do think it bears mentioning that she would be so incredibly proud and excited about our recipient this year. And she would also expect our event to continue without a hitch. So I'm going to continue to the task at hand. This afternoon, we're going to hear from speakers who know well the work of the Task Force for Global Health. Speakers who can tell you about lymphatic filariasis and elephantiasis. Individuals who have accomplished extraordinary feats in the global health arena. So as I thought about what I might be able to provide to you from behind this podium for a few moments today, I thought that perhaps I might share with you what my experience has been in working with the staff at the Task Force for Global Health during the past several months. Aside from being extraordinarily knowledgeable, accessible, and delightful to work with, there has been a theme that has surfaced in our work together. In virtually every phone conversation, every email exchange, every copy edit, we were asked and asked and asked again and again to please, please give credit where credit is due to the partners of the Task Force for Global Health. So Dave, Paul, and everyone else we have worked with so closely, we certainly hope that we have given proper credit to your partners who are indeed so deserving of recognition. However, today our job is to put your organization in the spotlight. While we know that your ability to keep your partners front and center is a large part of why you have accomplished all that you have, you do deserve at least a few minutes and perhaps even 2 hours in the spotlight today. I think the rest of us in this room can become students for the next 2 hours as we learn from you about exactly how you've gone about your work and what it has taken to accomplish your very ambitious goals. So with that, Dave Ross, Paul Olson, and everyone else at the task force, thank you for allowing us to put you in the spotlight today. Ladies and gentlemen, please enjoy the video we put together about the Task Force for Global Health.
If you don't have healthy people, they're not able to work, to think, to grow, to dream. So health is absolutely essential.
When you go into these areas, many of these people don't have a voice, and we are there to let them know that they are important and that we are going to make changes in their lives.
I've stood in hospital settings and watched babies dying by literally several per hour. This is an outrage, but we've worked at trying to keep those faces and those problems in mind and take action.
In 1984, Bill Foege was asked by the heads of the major global health and development organizations at the time to form a task force to focus on the issue of low childhood immunization rates.
When we met in March of 1984, measles was killing over 3 million children a year. I mean, an incredible toll. It was a daunting challenge to figure out how could we have an impact.
The task force and its members, through unprecedented collaboration, were able to raise the immunization rates in poor countries from 20% to 80% within 6 years.
The idea of working together to achieve something that neither could achieve alone was a demonstration of the power of collaboration. The second big collaboration that the task force took on was really the Mectizan donation program.
In 1987, Merck agreed to donate Mectizan as much as needed for as long as needed until river blindness was eliminated. This commitment ushered in the movement known as pharmacophilanthropy that has since resulted in billions of dollars of donations of essential medicines for neglected tropical diseases and other infectious diseases.
Diseases that have tormented mankind for history are currently being made history. We know what to do, we know how to do it, we know where to do it. The issue now is getting together in partnership to bring the resources all together. It can be done.
The task force's ability to effectively mobilize partnerships and resources has contributed to the organization's extraordinary impact on global health. The task force and its partners are working to eliminate 3 neglected tropical diseases: blinding trachoma, river blindness, and lymphatic filariasis by 2025.
As a child, my friends and I were all victims of trachoma. The suffering was terrible. And look at this beautiful girl. Her eyes are clear. She's free of this disease. The children are not suffering as we used to suffer.
It's truly magical to be able to see how it all comes together. We sit and we plan and we project and we talk about all the issues on the ground, but when you actually see it come together, it truly is magic.
Vaccines are a vital tool to protect health, and the task force works tirelessly to provide all people with equal access.
Going back to 1984, the origin of the task force was all around increasing immunizations in Africa. The task force then went on to do other things, but they wanted to come back to their roots, and so that was the origin of starting the Center for Vaccine Equity.
Weak health systems are also barriers to development. A field epidemiology training program at the task force called TEFANET helps train healthcare workers in how to detect and respond to disease outbreaks and injury patterns.
Now, TEFANET is more than 62 programs around the world with about 85 countries involved in this network.
With the right expertise coming together, we can start to address the real problems that children are facing.
The Public Health Informatics Institute's mission is to transform health practitioners' ability to use information effectively.
It's not the old public health style of simply collecting lots of data and keeping it in siloed databases and looking at it annually. That doesn't work in the 21st century, and the Public Health Informatics Institute has really been a catalyst for thinking about how are you going to use it to make people's health better.
The task force leverages resources for an extraordinary impact. In 2016, task force programs reached hundreds of millions of people in 151 countries.
In an often divided world, the task force provides a powerful example of how we can bring people and organizations together to solve the problems of the world's most disadvantaged. The task force makes the ambitious feasible.
It's an extraordinary privilege to be able to touch hundreds of millions of lives. Will we be able to do more? Without question. Will we be able to do even more important and impactful things? Without question.
The past 30 years has brought to the task force core capabilities that are needed for us to take the next step forward. We are poised to help promote health, protect health, and respond to threats to health all over the world in a way that we couldn't have done in the past. So our future is very bright.
Good afternoon, everyone. I'd like to tell you a few words about the prize itself, about Conrad Hilton the man, and about the task force. The Hilton Foundation created the Conrad and Hilton Humanitarian Prize in 1996 as a tribute to Conrad Hilton's lifetime of international humanitarian efforts. Every year, the $2 million award is presented to a nonprofit organization judged to have made extraordinary efforts and successes in alleviating human suffering. For 21 years, the unrestricted grant money of the Hilton Prize has helped further fuel the success of these world-class nonprofits, many of whom are in the room today. We're immensely proud of our history and work to date, and to be associated with such tremendous laureate organizations. We hope that the prize, and its stature as the largest humanitarian award in the world, provides a valuable seal of approval to organizations. We hope it opens doors, and we hope it facilitates and expands the already tremendous work being done by these world-class organizations. A word about Conrad Hilton himself. Conrad was a businessman and a philanthropist. First, he was a businessman with big dreams. He grew up in modest means. He purchased his first hotel in Cisco, Texas, almost 100 years ago in 1919. He built that into a chain of hotels in the 1920s, and then he lost all but one of them due to the Great Depression. He was kept afloat by hard work and by the help of friends and colleagues, which he never forgot. But still, even in the depths of the Depression, he knew how to dream big. When he read in a newspaper that the new Waldorf Astoria Hotel was built in New York in 1931, he cut the picture out from the newspaper and he kept it on his desk, saying, "Improbably, I am going to buy that hotel." And buy it he did in 1949. And in 1955, he made the largest commercial real estate deal in American history by buying the rival Statler hotels. One of Conrad's favorite phrases was, "Think big, act big, dream big." This phrase is written on the walls of the foundation. It's one of the basic values and drivers of our work, and it is the spirit of the Hilton Humanitarian Prize. Conrad Hilton was also a man of great compassion. He was charitable during his lifetime with a heart for the disadvantaged. He was grateful to those who had helped him and when he himself was in need, and he was shaped by a deep spirituality. On his death, he left 97% of his wealth to the Conrad and Hilton Foundation with the mandate in his last will and testament to relieve the suffering, the distressed, and the destitute. Since his hotel revenues had come from all over the world, so too he decided would the grants his foundation made be global without regard to race, religion, or country. And Conrad Hilton was a man of ideas and action. He saw the hotels he built in Istanbul, in Cairo, and Rabat as bridges of understanding between cultures, and I think he would have loved what Zainab had to say today. He would be troubled by today's divided world, globally and domestically, and he would have had ideas about how to improve things. Conrad Hilton would have appreciated the theme of this year's symposium as compassion, collaboration, and smart solutions were all part of his approach to business and to philanthropy. And he would have pushed us to articulate a vision and a dream of a high-performing system as we consider the future of humanitarian action. So, as we are gathered in the Waldorf Astoria, the crown jewel in Conrad's hotel empire, I feel he's with us here in spirit, impressed at how far his philanthropic efforts have come and how many people's lives he's touched as a result of a crazy dream he had in 1919 when he bought his first hotel. And he would certainly approve of this year's winner of the Hilton Humanitarian Prize, the Task Force for Global Health. Without a doubt, the task force thinks big, dreams big, and acts big. International in scope, this year's winner is dedicated to addressing large-scale health problems primarily affecting the world's poor. The task force specializes in neglected global diseases, vaccines, field epidemiology, and public health informatics, and works to provide all people the opportunity to live healthy and productive lives. Last year, the organization reached hundreds of millions of people in 151 countries as a result of collaborative programs that it supported around the world. And since its founding in 1984 by public health legend Dr. Bill Foege, here with us today. The task force has become an agile and valued platform for bringing organizations together to deliver high-impact solutions. And while I personally had no say in the jury's choice of the Task Force for Global Health, I have to say that I applauded wholeheartedly when I heard of the decision, because I, in my own career, saw firsthand the results and the ambition of their work. My own interaction with the task force began in the early 1990s when I was a 30-something, well, Hadil's age, field office director with Save the Children in Mali, in West Africa, one of the world's poorest countries. I worked in a district in the south of Mali, an area about half the size of Connecticut, with no electricity, no running water, no paved roads. And we, with the help of the Ministry of Health and many people, community leaders, we helped enroll tens of thousands of children in a health information system and worked to get all those children vaccinated. We delivered thousands of doses of Mectizan, provided free by Merck, to fight river blindness. A word that comes to mind when I think of that time is choreography. We all had a role to play, we had a time to be there, we had a place to be, and we knew what it was. I can remember when I came once to our district capital on a Friday evening with a message from the capital city, that there would be a vaccination team in a village about 90 kilometers away the next morning. And I tapped our program manager on the shoulder and I said, would you mind getting on your motorcycle and going out there and letting them know? And he was off like a shot. And that's the way we worked. We heard what we needed to do and we followed through. And remember, this is the time before cell phones, before the internet, before email. And all of that was accomplished with tremendous efficiency. We learned a lot of things about strategy, about logistics, about politics, and tackling big challenges. Lessons that we then applied to other fields such as education, microenterprise, water supply, and gender equality. What I didn't know then is that I was being given a master course in smart solutions by the task force, and which had transmitted to the farthest corners of the globe ideas about how to do this work and how to approach grand challenges, and transmitted them through organizations like WHO, like UNICEF, like Save the Children. Those lessons have been fundamental to my career and fundamental to thousands of other people. Now, the Hilton Prize jury was particularly impressed with the collaborative nature of the organization's work. You've heard the word a lot today, but I think you'll come away today with a stronger and richer definition of collaboration than you came in with. And as Maggie said, often working behind the scenes, not seeking the limelight for themselves, but helping other organizations accomplish amazing things that those organizations didn't think they themselves were capable of doing. So we applaud their smart, hard work, we applaud their humility, but we do think it's time to shine a spotlight on them for their tireless efforts and their impact on humanity. Now, the task force has received many accolades and has many admirers, among whom is our next speaker, who is joining us by video from the World Bank. Please join me in welcoming Dr. Jim Kim, President of the World Bank, to stage by video.
It gives me great pleasure to congratulate the Task Force for Global Health, and especially my friends and mentors, Bill Foege and Mark Rosenberg, for receiving the 2016 Conrad and Hilton Humanitarian Prize. If you want to understand the core moral convictions, operating model, and reasons for success of this great organization, all you have to do is look at how they were founded. In the 1970s, Halfdan Mahler, the head of the World Health Organization, and Jim Grant, who ran UNICEF, realized that they would have to build a strong coalition of partners to make real progress in raising vaccination rates for the major preventable diseases of childhood. Vaccination rates stood at the shamefully low rate of 20% in the developing world. The only person they knew who was technically competent and had both the professional stature and personal humility to make it happen was Bill Foege. With Bill and the newly formed task force holding things together, and by bringing in other partners such as the World Bank, the United Nations Development Program, and the Rockefeller Foundation, we witnessed one of the great miracles in the history of global health and development. Immunization rates rose to over 80% globally. One of the most difficult challenges in global development work is to build effective coalitions. Bill Foege and Mark Rosenberg figured out how to do this better than anyone else. They turned competitors into collaborators. Anyone who knows Bill or Mark understands that their wisdom comes from their humility, based on their experiences of witnessing the horror of children dying from preventable diseases, and for Mark, the many lives that are shattered by gun-related and other forms of violence. To me, the task force is a monument to the fundamental truth that movements for social justice for the poor require partnerships, but they also require courage, a courage born of humility. Finally, I want to share with you a practical lesson I learned from Bill Foege that I repeat often to my colleagues. Bill tells a story of his wonderful wife Paula, who, as a kindergarten teacher, walked into her classroom on the first day of school and told her students, "If any of you have to go to the bathroom, raise your hand." At which point a student immediately raised his hand and asked, "But how does that help?" Courage and humility are important if we want to get anything done in partnership. But as Paula and her student taught us, we also have to make sure that we're doing things that actually helps people. To Bill, Mark, and now Dave Ross, we are so grateful for all that you've given the world through your decades of committed work. Your example helps us to be more courageous and humble. And at the same time, we won't forget to ask ourselves when working on any issue, how does that help? Congratulations for receiving this great honor.
Thank you, Dr. Kim. Among the task force other admirers is a champion of social entrepreneurship who has been an agent for social change throughout her career, the president and CEO of the Skoll Foundation, Sally Osberg. Under Sally's leadership, the Skoll Foundation has invested in more than 100 ventures led by social entrepreneurs worldwide. She's the author of Getting Beyond Better, How Social Entrepreneurship Works, and she propels those around her with her life philosophy and mantra, captured in one word, onward. Please join me in welcoming Sally Osberg to the stage.
Got to get the microphones right. Wouldn't want any problem with the microphones for me or anybody else. Thank you, Peter. I think the word of the day is humility, and I am truly humbled to join you, the Hilton Foundation, your incredible honoree, and all you wonderful people here today. As our presidential campaign here in the US swings into its final weeks, we're continuously reminded of just how dark the mood is out there. It's a moment when huge swaths of the public distrust the very leaders and institutions charged with safeguarding all we hold dear, not only here in the US, but throughout the world. But it's a moment, and I use that word moment, when we gather here, not in shadow, but in light. Our great gift right here, right now, is to celebrate the leadership of an institution and that institution and all its partners who stand for all we know in our hearts to be true and enduring about humanity at its best. The story of how we got to this moment goes back nearly 200 years. In 1796, British physician and scientist Edward Jenner first inoculated a young boy with cowpox, thus successfully testing the world's first vaccine, the vaccine that would ultimately be the tool that conquered smallpox. But as anyone who's worked to bring about change at scale knows, and change at scale is what was called for in the case of smallpox, which was estimated to infect 60% of the world's population. Discovery of a vaccine, as with any technological breakthrough then as now, was only the first step. So while eradicating smallpox from the planet had long been a priority, it was not until 1959, more than 150 years later, that governments gathered at that World Health Assembly to to formally ratify the goal. To meet their ambitious target, you heard, just as Dr. Kim said, they called for collaboration among governments and legions of the partners they knew would be necessary to take on this goal and the strategy that would lead to achieving it. Dr. Bill Foege, the first pioneering leader we honor here, found himself on the front lines of this war, working in Africa as a consultant to the Center for Disease Control. Realizing the scope of the challenge to vaccinate 100% of the world's population was simply too vast, he wondered if the disease could be stopped by vaccinating only those who had been exposed to those already infected. The son of a Lutheran minister, Dr. Foege tapped the network of local ministers he knew to be working in eastern Nigeria and had them canvass every village and identify active cases of smallpox. He then put his team of public health workers to work, vaccinating only those villagers who'd been exposed. The strategy, which came to be known as surveillance and containment, or circle vaccination, worked. Forget what you've ever thought about social entrepreneurship. This is what it is. It is change at scale. It is discovering the levers to drive change at scale, and it is pulling those levers, often with resources that other people have not seen. The method worked. Smallpox began to recede and ultimately disappear. The innovative approach was employed across Africa and eventually in one of the great strongholds of the disease in India. In 1980, the WHO officially declared smallpox to be the first consequential human disease eradicated from the planet. This wonderful victory was the shot in the arm the WHO needed to set an even more ambitious target, and you've heard about that too this afternoon, to immunize the world's children against diseases for which vaccines existed. But your bureaucracies, as most of us know, aren't especially nimble or swift, and so the effort languished. Once again, it was Dr. Foege who helped convene the players, UN agency heads, philanthropic leaders, the bank, others, to see what might be done to accelerate the pace and success of the endeavor. And from that storied gathering, the one Dr. Kim just described, came the Task Force for Child Survival. Its charter was clear: to facilitate, not to coordinate, but to facilitate increased rates of vaccination. And you've heard about the stupendous success over 6 years. The rates went from 20% to 80%. This remarkable milestone was announced at the 1990 Summit for Children at the UN and justly heralded as the greatest peacetime endeavor the world had ever seen. The second leader we celebrate this afternoon is Dr. Mark Rosenberg. Mark took the helm of what had now become the Task Force for Global Health in 2000, charting the extraordinary trajectory of growth that continues to this day. It was Mark who brought the International Trachoma Initiative on board, and it is he who is credited with making the task force the fourth largest not-for-profit organization in the US. More importantly, because size is no measure of how good you are at your work, more importantly, over the first few years of his tenure, he codified, socialized, and put into practice the values and principles underlying the task force's work. The first of those values was compassion. In 2010, Dr. Rosenberg even gathered a remarkable public health leaders symposium on the subject of compassion, among whose attendees was President Jimmy Carter. For the task force, compassion is non-negotiable. Dr. Rosenberg and his colleagues believe that the throbbing heart of effective practice in public health is a profound sense of shared humanity. To be effective, all must see, truly see, the faces of those who are served, not as some amorphous population or anonymous sample, but as individuals, as human beings, whose lives and experience, whose suffering and whose health are etched in their faces. At the same time, Dr. Rosenberg has been steadfast in insisting on the highest and most vigorous application of scientific rigor, which has required members to invest the time and discipline necessary to get to a shared understanding of the last mile to success, what it will look like, and what it will require. Little wonder that the task force's board chair, Jane Thorpe, announced Dr. Rosenberg's decision to retire with mixed emotions early this year. Ms. Thorpe's letter of announcement went on, however, to note that exceptional leadership runs deep at the task force, and that David Ross would succeed, oh, maybe exceed too, well, how about it? Would succeed Mark Rosenberg. Dave joined the task force in 2000 as director of a program to improve immunization record systems for children. Dave is an engineer by training. Early in his career, he worked in an unlikely field, the defense industry, and yes, with the nuclear arsenal. In time, however, he decided to apply his passion for technology and information to saving lives and to the domain of public health. At the task force, he has focused on the role of information, establishing the Public Health Informatics Institute and leading worldwide efforts to improve health outcomes with accurate information. More recently, Dave has been instrumental in creating CHAMPS, the Childhood Health and Mortality Prevention Surveillance Network, spurred by the reality that 6 million children still die each year from preventable causes. CHAMPS began its groundbreaking work last year. Yes, exceptional leadership at the task force runs deep, and dare I say, it runs broad through its partnership and through all the people it empowers in all the communities it serves. And yes, leadership of the kind we all value and know to be a true expression of our shared humanity is worth celebrating. Jean Monnet, architect of the EU, liked to say that nothing changes without individuals and nothing lasts without institutions. This afternoon, we celebrate both. It's my great privilege now to ask you to welcome Task Force President and CEO, David Ross.
Get this right. Well, thank you, Sally. Thank you so much for a very kind introduction. Thanks to all of you for being here and for contributing to really thought-provoking discussions yesterday and today. Peter, Maggie, the board, the jury, we thank you. Zainab, for your lunch talk, it was absolutely inspiring. And it brought back to me a memory I had in the early 2000s at a refugee camp in Zambia, where as the sun was setting late in the day, we were visiting refugees who were internally displaced because of the HIV/AIDS epidemic. And I knelt down with this little boy who came running up to say hello. He was probably 4 years old, I'm guessing. Was naked. He didn't have clothes even. But as I knelt down to say hello, what I saw was that by kneeling down and looking at him eye to eye, and we were at a water kind of faucet there in this camp and helping him with the water, it was talking to him, asking his name, endorsing him, and dignifying him as a human that really made the difference. And I realized, Zainab, what you said today is absolutely true. We are about building dignity. So thank you for your remarks. I want to thank the Hilton Foundation for honoring the Task Force for Global Health with the 2016 Conrad and Hilton Humanitarian Prize. We are humbled. This is a word we've heard a lot today, but it is absolutely genuine. We are humbled by this extraordinary recognition. And Maggie, like you, I stand in awe of all the speakers we've heard today. This is so enriching. Thank you. We celebrate today more than 3 decades of contributions to global health, and there are many, many people who've made this honor possible. We saw the movie, so thank you. There are far too many to name, but there are a few who I must call out. So I will start with Dr. Bill Foege. As you saw in the video, he, along with his colleagues Bill Watson and Carol Walters, founded the task force based on a model of collaboration to solve large-scale health problems. I would also like to and must recognize my immediate predecessor, colleague, and friend, Dr. Mark Rosenberg, who led the task force to become the organization that we're celebrating today. So I have the good fortune of having been CEO for 5 months, and here I stand giving this speech. These 2 gentlemen should be here speaking. I also want to thank our board members who are present here today, Carol Walters, Jane Thorpe, our board chair, Pete McTeer, and Dr. Jim Curran. And I must also offer a very special thanks to Jane. I think she is the model of what is the very best in a board chair for an organization like ours. I also want to recognize and thank Dr. Howard Hyatt, who's not here today with us. He is the Dean Emeritus of the Harvard School of Public Health, and it was Howard who nominated us for this award, so thank you, Howard. Finally, I'd like to recognize our staff, some of whom are here today, but staff both current and past. A number of them, as I say, are here. These are people who are some of the best minds in public health, definitely some of the most generous, caring, and compassionate spirits. So for those of you on our staff who are here, would you please wave your hand so people can look around and see you? Thank you. So the task force is, at its core, a group of people dedicated to the very enormous task of improving the health of the most vulnerable and marginalized people in the world, many of whom who live in poverty. We know that good health is a challenge for the world's poor who struggle to meet the basic necessities of life, including access to adequate food, clean water, and basic health services, including vaccines and medicines. Poverty puts people at greater risk for a host of diseases that have long been conquered in other parts of the world. These diseases cut lives short and cause untold suffering. But they do more than that. They burden people's health. They take away one's ability to take care of their families. They rob children of education and therefore hope for a better future. And ultimately, they help trap people in cycles of poverty. At the task force, we don't accept the inevitability of these diseases. We see a world with resources and expertise that can prevent and control and eliminate them. So then how do we connect the solution with the need? So we've recognized that complex global health problems are too big for any one organization to solve alone. Solving them requires collaboration and collaborative efforts of many organizations, often across multiple sectors. So this has been our approach to addressing global health challenges for more than 3 decades and will continue to be our practice going forward. Our work is rooted in a belief that all lives have equal value and everyone should have access to the means for good health. It's not enough to simply believe that. we are compelled to make it happen, and that is what we call consequential compassion. So as we gather in this elegant ballroom today, we know that if any one of us has an emergency, medical care is just around the corner. Medical care is available. You can even go to the CVS on the corner and get your seasonal flu vaccine. We have access to health care and vaccines and medicines. Across the country, we are also protected by public health systems that can respond to disease outbreaks and other health threats. But that's not the norm in the rest of the world. The world that the task force serves is different than the one that we know here. A group of infectious diseases called neglected tropical diseases that are virtually unknown in the US plague the world's poor with blindness, disfigurement, cognitive impairment, and even death. Due to the lack of vaccines, influenza kills up to 500,000 people every year in low and middle income countries. Our goal is a world where neglected tropical diseases are no longer health problems and everyone has access to vaccines and essential medicines. So I'd like to share 2 examples of how our work is changing the picture for health of the world's poor. In Ethiopia, which has the world's highest rate of trachoma, this disease has sadly been accepted as a part of life in rural parts of that country. In fact, some people consider blindness a normal part of aging. Imagine thinking that if I live long enough, I may become blind. So the means to eliminate this terrible disease is available today. And thanks to our pharmaceutical partner Pfizer and other partners, trachoma will hopefully be eliminated in Ethiopia and in other countries in a few years. At the task force, we work with countries and partners to implement large-scale, multi-sector programs to eliminate trachoma. This includes then supporting the mass drug administration with antibiotics donated by Pfizer. This year alone, our collaborative efforts will provide treatment to more than 100 million people threatened by trachoma. So this is a very massive undertaking, and it is possible only because of the kind of collaborations that are built and sustained. We've also been working on polio eradication for a number of years. While eradication has taken longer than initially expected, the number of cases of paralytic polio has declined from 1,000 every day in 1988 to just 26 cases total so far this year. The disease now exists only in a handful of countries, and hopefully it soon will also be wiped off the face of the earth. We recently supported the worldwide switch to a safer form of oral polio vaccine, which is one important step towards eliminating polio. Earlier this year, in a period of less than a month, 155 countries switched to this safer form of vaccine. This was really unprecedented in the history of the world. So we learned a lot from this experience. We learned that you can address a big problem with many countries. We know now that with a lot of preparation, it is possible for 155 countries to work together on a single health issue in a short period of time. It is possible. This experience also speaks to the potential for collaboration for addressing other large-scale humanitarian issues like refugee crisis. As was said earlier today, we know that conflicts, climate change, and natural disasters are going to result in mass migrations in the future. So I think it will be critical for us to think about how we can plan ahead to address events before they occur. In his book, my colleague Dr. Mark Rosenberg boils down effective collaboration to 3 main elements: identifying the problem, bringing together the right partners, and implementing an effective, sustainable response. We know that a robust response to refugee crises must involve multiple parties working together in a coordinated manner for a long, prolonged period of time. Our experience in building coalitions that have staying power, and I think I have to underscore that part, that have staying power, tells me that a crisis is not the time to hand out one's business card. It's not the time to try to get to know your partners. We can plan in advance. We need to develop coalitions now that prepare for response. We know that success from public health preparedness in the United States, that it is possible to predict where and when to respond. We can pre-position medicines and medical supplies and vaccines around the world for rapid response. This was discussed this morning. Public health also has the tools needed for identifying and tracking displaced people, which is going to be needed to handle mass migrations. Right now, several of our programs are using inexpensive and flexible smartphone technology to collect a variety of health information from populations in countries around the world. These systems could easily be adapted for use in refugee crises. We can expect refugee crises to be accompanied by infectious disease outbreaks. Again, we know this is going to happen. To respond to these contingencies, we will need basic public health surveillance that includes trained frontline workforce and the requisite tools for detecting and responding to outbreaks. I think done correctly, we can design and prepare coalitions and core public health responses today that will be needed in the event of future refugee crises. In our work, while we help countries control and eliminate diseases, we can also build critical infrastructure necessary for strong and sustainable public health systems. And I know that many of the laureate organizations represented here today would join me in saying, yes, we can join together and plan ahead and mitigate some of the challenges that we see today. So these include logistical systems to deliver essential medicines and vaccines, disease surveillance systems that also include training frontline workers and how to recognize and manage disease outbreak response, and of course, human resource information systems that enable countries to manage their workforce effectively. So this will be our lasting legacy, sustainable public health systems that can respond to issues from within rather than relying totally on external resources and personnel. Earlier, I mentioned the concept of consequential compassion. It's not enough for us to feel something needs to be done to alleviate suffering and disease and childhood mortality. All of us in this room and many, many people around the world feel that way. At the task force, we believe that we have a responsibility to act, to help those most in need. That is our mission. It is to act. So as I close, you may be asking yourselves, what are we going to do with this wonderful prize money? As I've said to all of my colleagues, I really didn't expect this. This is a very lovely problem to have to deal with, but not one I thought I would be dealing with. Because of our unexpected and somewhat unprecedented growth in the recent years, due to the success of our programs, we have to acquire more space in Atlanta, where we're based. So we'll be using the Hilton Prize money to help us purchase a new facility. That new facility will help us unlock our capacity to help more people. We also see this as a facility serving as a new hub for global health in the Atlanta area by bringing together organizations who together with us can help solve complex problems. The additional space also gives us the capacity to move into other areas of global health need, particularly non-communicable diseases and injuries. So where we know there is a huge and growing demand for our services and the kind of help that we can provide in building coalitions. Dr. Fege speaks frequently about the optimism for future of global health. Our own future has never been brighter. So I will close with a vision of the world as we think it should be. This is a vision where it's a world where all children receive necessary immunizations. It's a world where every community is protected by public health systems that can predict and detect and respond to health threats. And it's a world where all countries can meet the needs of their populations. So that's a nice vision. We're not there and not going to get there anytime soon. But we are optimistic that we will keep working at this. Ultimately, we're trying to work ourselves out of a job. Our goal is to help those who can help themselves. And when they can do that, we can turn off the lights and go home. So on behalf of my colleagues, past and present, we are humbled and incredibly appreciative of the acknowledgement that the Hilton Humanitarian Prize affords us and bestows on us. This recognition emboldens us with confidence to act, to do more, and to do more sooner. You've helped set us further down the path. We thank you very much. And we will be thrilled to join the coalition of laureate partners. Thank you.
So Dave Ross and all of your colleagues, past and present, it's our honor to present you with the 2016 Hilton Humanitarian Prize and to welcome you into the laureate family. Thank you.
Thank you very much. Thank you.
Pleasure.
This is Andrew.